For thousands of years, teas have been praised for their health-promoting benefits. Originating in China and India, teas have made their way into Western culture as a beverage to help sustain and promote well-being. In fact, the most popular beverage in the world are teas. All non-herbal teas are derived from the Camellia sinensis plant. White tea, green tea, oolong tea, and black tea all originate from this plant. Now, what determines whether something's going to be a white tea, a green tea, a oolong tea, or a black tea is the age of the leaf and how it's processed. White and green teas are less mature than oolong and black teas. Now, this has significant implications in terms of the types of phytonutrients, the types of antioxidants the tea has. The less mature tea leaves, the less oxidized tea leaves, such as white tea and green tea, usually have a higher antioxidant content, with most research suggesting that green tea has the highest antioxidant content because it has the highest concentration of a specific type of flavonoid called a catechin, and more precisely something called epigallocatechin 3 gallate. That's a tough one to say. Epigallocatechin 3 gallate. Now, black tea and oolong tea, while having less of this specific type of catechin, have another type of potent antioxidant called a theoflavin. So probably these different classes of tea complement each other, and if you're a tea drinker, you should try to implement all varieties into your weekly consumption. Now, interestingly, some research suggests that the dry weight of tea is, green tea specifically, is up to 40% polyphenols. And so this is an incredibly nutritious beverage. So it's low calorie, but it has these amazing diverse types of antioxidants and a very high concentration. Research even suggests that epigallocatechin 3 gallate is 25 to 100 times more potent of an antioxidant compared to vitamin C and vitamin E. Additionally, the antioxidants within green tea have been shown to possess anti-inflammatory properties. Specifically, they've been shown to reduce the activity and activation of a transcription factor called nuclear factor kappa beta. Nuclear factor kappa beta is a protein that helps determine what genes are activated. And this particular protein tends to activate genes that magnify and amplify inflammation. And so if you have a substance, such as the substances found in green tea, that reduce the activity of this particular factor, then the logic would suggest that the overall inflammation is diminished. And we've established over and over and over again that chronic low-grade inflammation helps accelerate premature aging of vital musculoskeletal structures. The potent antioxidants in non-herbal teas may support joint health. Free radicals attack vital protein, DNA, and fats in joint structures. The antioxidant properties of green tea and white tea and oolong tea and black tea potentially can help diminish their effectiveness. Iranian researchers examined the effect of a green tea extract on individuals with unhealthy joints. What they observed is that the group treated with the extract reported less unhealthy knee symptoms and had better function. Green, white, oolong, and black tea may boost bone health. Researchers in China examined the effect of daily consumption of tea on the overall bone density of over 12,000 individuals in China. What they observed is that individual who had a higher consumption of tea had a higher bone density in their low back their hips, and their thighs. Some researchers suggest that the active ingredients in teas help decrease the formation of osteoclasts and promote the cell death of osteoclasts. Now recall that osteoclasts are specialized cells localized in bone that eat bone away and cause absorption of bone. Teas derived from the Camellia sinensis plant may promote tendon health. Brazilian researchers using a rat model of Achilles tendonitis found that the group treated with a green tea extract had increased production of collagen and other proteoglycans that help promote tendon healing and tendon strength. While the exact mechanism is poorly understood, researchers suggest that the green tea extract was able to inhibit the effectiveness of an enzyme called collagenase that actually breaks down collagen into small units. And recall that collagen makes up 90% of the tendon. Green tea, white tea, oolong tea, and black tea potentially promote muscle health. Researchers in West Virginia evaluated the effect of a green tea extract on a rat model of sarcopenia. Now, sarcopenia is a condition in which you have significant muscle mass loss. What they observed is that the rats treated with the green tea extract had a greater stimulation of muscle stem cells, and these stem cells are something that can create new muscle, and they also had less atrophy. Many authors think that the potent antioxidants and anti-inflammatory agents help reduce inflammation and oxidative stress in the muscle. And as has been emphasized, if you have oxidative stress and you have chronic inflammation, it really causes deterioration of muscle function and loss of muscle cells. Again, rich sources of non-herbal tea from the Camellia sinensis plant are white tea, green tea, oolong tea, and black tea. Green tea, white tea, oolong tea, and black tea from natural sources are generally well tolerated. If you drink more than 5 cups per day, there is some suggestion that you might have some mild GI distress. However, green tea extracts have been associated with liver toxicity in very high doses or people who have pre-existing liver conditions. So any consideration of supplementation must be discussed with a qualified health practitioner familiar with your unique medical history.